Well, it's no doubt the pandemic has taken a toll on everyone, and now it's an important time to focus on both your physical and mental health.
So joining us with some tips is internal medicine specialist, Dr. Abha. Thanks so much for joining us this morning.
Good morning, Deanna. Mike, thank you for having me.
Absolutely. Always a pleasure to see you, doctor. Let's first talk about this pandemic. Obviously, we're approaching a full year of this now, and it really has taken a mental toll on a lot of people. What is your advice to those who are still struggling?
I want to begin by thanking you. Thank you both for reporting to work every single day, and to the millions of Americans here in West Michigan and beyond. It's been a huge toll and a huge ask, so thank yourselves for your compliance. Number one, get vaccinated. Number two, go to your doctor. Don't neglect symptoms of depression or loneliness. And number three, get back to those activities of daily living that bring you so much joy. Crank up the music and dance. Get a pet to love, go outside, whatever it is that brings you joy, but do not neglect your mental health, somehow believing it pales in comparison to your physical. That's simply not true.
Do you think that the conversation around mental health, I guess, if you will, kind of maybe the positive that came out of this is that more people are talking about it and people are becoming more aware of just how important it is to take care of that?
That's a great question, Deanna. There's always going to be a stigma surrounding mental health. 1 out of 4 to 1 out of 5 of my patients have come to me and said, Doc, I can't put my finger on this. I just don't feel like getting out of bed. I want to do the bare minimum. What do you think is going on? And after we've talked about issues like anemia or thyroid disease, perimenopause, or whatever the hormonal issues could be, I ask them, do you think you're depressed? And they smile and they say, you know what, you're probably right. There might yet be a reluctance to call a lot of malaise and fatigue depression or anxiety. But Deanna, I think that's exactly what it is. And I do believe that more people, because we have a place to blame it, which is the pandemic and the isolation, people might be more apt to identify it and then ask their doctors to do something with them about it.
Doctor, obviously the pandemic has forced us out of our normal in a lot of ways, especially if those who are part of the routine is the fitness part of this whole thing. What kind of impact has it had on those people who now may not be able to do the things that they want, which obviously is affecting their overall health?
Excellent question. 40% of women and 20% of men, and growing, identified weight gain. And we know with weight gain, we see mounting issues like diabetes, hypertension, heart disease. We've implicated obesity as a risk factor for serious COVID ramifications, likewise heart disease, diabetes, and hypertension. So the lack of physical activity definitely adds burdensome numbers to our COVID pandemic in cases. The answer is this: walking was never prohibited. This was not Europe, where people had to have a permit to walk their dog. I've implored my patients from day one, get outside, breathe fresh air, wear weather appropriate clothing. And now, as our weatherman has already shown us, we have absolutely no excuses. We must all get outside today with our gorgeous weather upon us, and even commune with people. Wear your masks, maintain your distances, but feel comfortable seeing people in a safe way, maintaining those safe measures and filling your cup and your heart again. I think human interaction has been so challenged by this pandemic for obvious reasons. I think as long as people are getting vaccinated and have gotten both vaccines, you're that much closer to opening up your country, your locale, and continue to maintain your common sense measures, but please don't neglect your physical or mental health. Get outside and get fit.
Well, thank you so much. We always appreciate chatting with you and all of your advice.
I appreciate your having me. Have a good day.